First of all, we'll just introduce ourselves. I'm Julie Randall, and this is Troy Andrews, and we work at Mary Lou Corcoran Physical Therapy in Fayetteville. So we're right in town center, for you that aren't familiar with the Fayetteville area, right across from Tops. And we're going to give a talk on back pain. So the title of our talk is Rules for a Healthy Back, which several of you probably have experienced back pain in your days. Before we start, I'll give you a little bio on myself. I've been practicing physical therapy since 1999. I went to Damon College in Buffalo, and I've done primarily outpatient orthopedic physical therapy since that time. I treat a wide variety of injuries and issues. We see back pain, probably the most common. I also specialize in running injuries and athletic issues. I'm a runner myself. And I also do a lot with the sacroiliac joint, which we'll go into a little bit, neck pain, hip and knee issues. And I'll let Troy do a little bio on himself.
My name's Troy Andrews. I've been a physical therapist for about 20 years now. And I treat everything, backs, necks, hips, shoulders. And we do see a lot of back injuries. And one of the interesting statistics is that 80% of the people in the world have back pain at some time or another, and 90% of those will have a recurrent episode of back pain as they're going on in aging. So it is quite an epidemic that goes on, but hopefully we'll be able to show you some things that will help keep it at a low key for you.
All right. Let me get this on here. So rules for a healthy back. Can you guys hear that okay? So the 3 rules we came up with, number 1 is know your back. And by that we mean understand what you're treating before you start doing some exercise program or going to the gym and trying out a machine. We see a lot of patients that come in and, their Aunt June will say, try this exercise. And they'll do it, and it might make them worse. Sometimes it makes them better. But just make sure you know what you're working with before you start doing an exercise program or monkeying around with some home remedy. Number 2, know your back do's and don'ts. So we're going to go over some things that are good to do that might help with what you have going on and some things to avoid so your symptoms don't get worse. Number 3, treat your back right, meaning just do the right things as far as things around the house. Proper bending, proper sitting, proper posture, how to vacuum so you don't hurt yourself. So the 5 diagnoses that we see most commonly, number 1 is spinal stenosis, number 2, lumbar disc, 3, SI joint or sacroiliac joint issues, sciatica, which I'm sure a lot of you have heard, and you probably wonder what that means. It's a catch-all term for several things, and Piriformis syndrome. So the first one we'll talk about is spinal stenosis. It's a very common issue that we see often. Stenosis refers to a narrowing. So when you add spinal stenosis to that, it means there's a narrowing in your spine. And when that happens, there's less space for your nerves to do what they should do. It commonly occurs with arthritic conditions. People will get bone spurs from the arthritis, or they'll have inflammation from the arthritis, and that's going to narrow the space, putting pressure on your nerves that shouldn't be there. So a nerve will get pinched. Positions can cause it to pinch worse, sitting versus standing. Symptoms are usually one-sided, but they can be both sides, and you can get effective treatment with physical therapy. There's 2 types of stenosis. There's lateral and central. And let me look at my little notes here. Central affects both legs. Lateral affects one. Most people that have lateral stenosis tend to do a little bit better than central. It's a little easier to treat. And this is central. So central will usually pinch on the spinal cord and affect both legs, so the symptoms can be a little bit more severe. So sometimes physical therapy, you'll do a few sessions, and sometimes it helps, sometimes it doesn't. So you may have to have other interventions. Lumbar disc, I'm sure a lot of you have heard of disc bulge, disc herniation. A bulge is very common. A lot of people, if you MRI'd everyone in the room, would probably have a disc bulge. They most of the time are asymptomatic. They don't usually cause pain. A disc herniation, however, puts a little bit more pressure on the nerves and usually causes symptoms. So that's when most people need treatment. You can also have disc degeneration, which is more an arthritic type issue, where the wear and tear over time, you'll wear down the fluid that's in the disc, and the disc space will get more narrowed, causing more issues. Symptoms can be one or both sides. You can have symptoms only in the back. Sometimes you'll have them in the leg. Symptoms can be pain. They can be numbness and tingling. You'll have muscle weakness at times. And treatment is usually very effective in physical therapy. SI joint. This is the sacroiliac joint, and it's the joint between your pelvis and your spine. It kind of connects your upper body to your lower body, if you think of it that way. And it's a joint that some people are aware of, some people aren't. It's not a joint that has a lot of mobility like your knee or your hip might. It moves very slightly, but if it does move or get stuck out of alignment, it can cause a lot of issues. And we see this quite often. You can have a rotation, an upslip, which are just certain terms depending on how it moves. Sometimes if you have an SI issue, you can have just pain. Sometimes you can have numbness. Sometimes you can have muscle spasms. A common thing we see with it is you'll feel like one leg's longer than the other. So sometimes people will come in and they say they feel crooked or they feel like they're just a little bit off. And usually that's because the muscles will spasm or tighten on one side depending on where the issue is, throwing your gait off. And physical therapy is very effective for SI joint issues. Sciatica. So I'm sure you've all heard sciatica. And if you have back pain, you probably ask your neighbor and they say it's just sciatica. No big deal. All sciatica really means is leg pain. And it can be caused from several different things. It can be due to spinal stenosis. It can be due to a disc issue. It can be due to an SI joint problem. The sciatic nerve is a very long nerve. And it essentially, if you look at the picture, it goes from your spine all the way down into your foot. So you can have pain anywhere along that pattern. The most common symptoms people say is they have pain in their butt, and they go to the doctor and they say you have sciatica. It is something that's very treatable. So if you do have any symptoms in the leg, that's a good time to go to the doctor or go to a physical therapist. Because most likely some stretching, which we'll go over, some exercises can take the pressure off the nerve and alleviate your symptoms. Radicular symptoms. This is another term that kind of refers to pain down your leg. You can also have radicular symptoms in your arm, depending on what nerves are irritated. And this, again, can be caused from what we talked about. Spinal stenosis can cause this, disc issues, SI joint, or piriformis. And then piriformis syndrome, which is related to sciatica, which we talked about. Your piriformis muscle is a muscle in your buttock region, and in a small percentage of the population, the sciatic nerve can pierce the muscle and go through it, but normally that muscle can sit on that nerve. And if that muscle gets tight from either an injury, overuse, or postural changes, that nerve will get pinched, causing pain. So you'll end up with those similar leg symptoms that we showed on the last slide. And physical therapy is very effective for piriformis syndrome. So now we'll go into know your back do's and don'ts. And I'll pass the mic to Troy.
Works good. Okay, so back do's and don'ts. One of the big things is we present those diagnoses because if you know what your diagnosis is, then it's going to be a lot easier for you to pick out what you need to do to make sure your back stays healthy. Okay, and we're going to go over some of those with you. So spinal stenosis or lateral stenosis, or where the nerve comes out the side of the back, it'll go out both sides where it'll get pinched. And I tell everybody, stenosis like this is kind of like crushing a tin can. When you start to crush a tin can, one side's going to go a little bit more than the other. And then that's going to be the side that's going to get pinched and cause the symptoms down the leg. We were talking about sciatica. And sciatica, or leg pain, sciatica, the sciatic nerve goes down the back, as Julie was saying. So when somebody talks about a piercing pain going right down the back of the leg, that's going to affect the spot that's lower down in the spine, because there's different areas of the spine that coordinate with different areas of where you have pain. And the slide that we had before showed there are all these different lines on the body. And when you start to have pain in the front of the leg, it's usually higher up the back. And when you have pain in the back of the leg and down lower into the foot, that means it starts getting lower down in your pelvis, down near your tailbone area when you get into that area. So with stenosis, with that compression, one of the things we need to do is strengthen the core muscles. The core muscles, everybody thinks is, okay, I got to do sit-ups, I got to do this. Core muscles are, when I go to bend over, do I make all of my muscles start to stabilize my back so that when I bend, I'm not leaning over like this or doing those types of things. So core muscles can be very different. I can strengthen my core muscles by pulling on some tubing, and my stomach and my low back tighten up at the same time. I can do core muscle strengthening by sitting in a chair and just marching my feet back and forth, and because it helps me hold my posture. And if I start to have pain with that, then that tells me that I might be not using my muscles the right way, and I have to start to do that a little bit more. Okay? We talk about stretching exercises. Stenosis, lots of times when you have the lateral stenosis, since it's on one side, if it's getting pinched down this way, then guess what? Leaning the other way usually starts to relieve the pain. Bending forward will usually relieve some of the pain if it happens with the stenosis. With the central canal stenosis, the movements don't really affect it as much because it's right in the center of the spine, not off to the sides. So that's why we say sometimes PT isn't as effective with the central canal as it is with the lateral stenosis. We're talking about maintaining good posture. Now, when you have stenosis, good posture may not be right, straight, and down. When we talk about good posture, it's more or less maintaining the alignment of the spine so that you're in the right position. I don't have the same posture as Julie does. So if I try and stand like Julie does, it may start to make me hurt because my spine is in a little different position, and I've done a lot of different things to my body than she has done to hers. I played football and rode motocross and did all that stuff. So my upper body, and I've had some injuries, so my upper body, my posture is going to be a little bit more rounded. If I try and stand up too far, I may start to actually cause some of these impingements that we talk about. So when people say have good posture, it doesn't mean you have to have this ramrod posture and be poindextery, so to speak. It means that you have to hold a posture that's going to be good for your alignment. We talked about forward bending, because when you stand and you bend, oops, I went backwards. Okay, when you stand and you bend backwards, it's going to start to put more pressure on the nerves on the outside of the spine. When you bend forwards, the spine opens up and it relieves the pressure and it makes it feel better. That's why lots of times you'll hear people, when they go grocery shopping, if they have stenosis, they like to lean on a grocery cart and go through the store like this because it doesn't hurt them anymore. So they'll go forward like that. So knowing those things can help you learn how to stay out of those bad positions. Sleeping on your back with pillows underneath your knees, kind of in that bent position, is a great way to sleep to take pressure off. And once those nerves get pinched, it's kind of like slamming your finger in the door. When you slam your finger in the door, you can take it out of the door, but it's still going to hurt for a while. So you got to have a way to keep the pressure off of it. And these exercises and learning how to sleep the correct way will help. And if you lay on your side with the side that hurts up, it will help keep some of that pressure off of that area also. So sometimes people lying on their back doesn't help. Sometimes it's a little too much of a pinch, so they still have to lay on their side, put a pillow between the legs, and it makes them feel better that way. The don'ts, when you have stenosis, you want to avoid carrying those heavy objects because we talked about compression. The more compression, the more it hurts. If you are carrying heavy objects, if your pain is on your right side and you put the bag in your right hand, you're just going to pinch on it more. So if for some reason it's acting up and you're having a problem, try and carry it in the left side and keep the pressure off of it the best you can is a way to do it. Lifting objects overhead, anytime you get anything up like this, you can see that makes me extend my spine, and now I'm getting pressured down onto that. That'll hurt more also. Sometimes we'll have people come in and say, You know, my stenosis doesn't bother me all day except for at nighttime when I unload the dishwasher, and then I take the load of dishes and I try and put all of them up in the cupboard. It really hurts. Well, I say, well, just put them one at a time. It won't bother you as much. Because plates get pretty heavy if you ever put a lot of them in there. So avoid the backward bending, and then don't sleep on the stomach. Because we talked about how your body likes to do this to open up the spine. So if you lay on your stomach, it's going to sink in and it's going to bend this way, and that's going to make you have more issues. And you can see right here, holding the back, and it's right around the center of the spine is where you get the pain, and then it'll go out to either side. Lumbar disc, we talked about slip disc, which is like a bulging disc, ruptured discs, herniated discs. Herniated discs are when the disc actually opens up and some of the fluid that's in the disc comes out. Everybody describes the disc as like a jelly donut. The jelly inside of it is what we call the annulus, and the outside of it is basically part of what, or is the propulsus, is the inside of it, and the outside is the annulus. And that jelly donut, if you squish it, the jelly starts to come out. Well, that jelly is kind of like acid and irritation to the nerves. So when it starts to come out, that's when we'll see people that no matter what way we bend them or move them, they don't get any relief of pain. They take pain medication, it doesn't help. They do all this stuff, it doesn't help. You ice it, you heat it. And lots of times those people are so inflamed, and with that jelly out there, you have to kind of wait till it just kind of calms down. With the lumbar disc, it's the same thing. We have to learn how to support it. This will bulge to the back, to the right, to the left. So you can have pain going down your right leg, and if you bend forward, if it hurts a lot more, possibility of a disc or a muscle injury. If you bend backwards and it hurts more, still a possibility of a disc injury, because when it bulges out, it's going to be sticking out there. So lots of times when people have back pain, you know, they always say, well, what should I do, Troy? They'll call me up on the phone, my back hurts, what do you want me to do? And I'm like, well, I really have to see what you're doing bending forward, backwards, side to side, before I can tell you a good thing to do. Because if you bend forward and it makes you feel better, then chances are it might be a muscle or stenosis. But as you can see, if it's a disc and it's bulged out there, if I bend forward, it's going to push out more and it's going to hurt more. If I bend backwards, it might pinch it in there and it might hurt more. Now you really aren't sure what to do. So usually bending backwards, once the disc is in the right position, helps to strengthen the muscle, push the disc forward, get it out of the place so it doesn't pinch on the nerve. Again, we talk about maintaining good posture. Good posture, again, everybody says, okay, don't slouch, don't do this, don't do that. Thank you for sitting up. No, I'm just kidding. But, thanks. So, but basically, again, it's the same thing. People's postures will be different, and sometimes, you know, when you go to physical therapy, you have to think you sit up real tall, and sometimes you're actually hurting what you're doing than you are helping it, or you really don't have an idea on what your actual body posture is. Somebody could be standing here going, I'm standing up as straight as I can right now. Well, if we just move their hips a little bit, now they're standing up straight. So they might be fighting themselves on that. With the pillow, or with the disc, sleeping on pillows on your stomach will usually help to open up and take pressure off of the disc, and then gravity will help slide that disc back into place and relieve the pressure and the pain. Okay? Oddly enough, if you have stenosis, sleeping on your stomach with some pillows is going to open it up and make it feel better too. And if you have a muscular injury and it's a pulled muscle and we need to stretch it out and relax it a little bit, laying on your stomach helps also. So I usually tell people, when in doubt, you don't know what's going on, see if you can lie over one pillow or two pillows on your stomach. And if you lie there for a couple minutes and the pain starts to go away, well, at least it's getting better. You won't know if it's a stenosis or a disc or a muscle, but at least you've done something to help it a little bit. So that's usually when they call me on the phone and ask me what to do, that's what I tell them to do. The other thing is you can lie on your side with a pillow between your legs. So if that disc is bulging out to the right, and I lay on my side and I put a pillow between my legs, what will happen is it'll take the pressure off of my hips and pelvis, release the pressure on the disc, and sometimes it takes the pain out of the leg. If I lay the other way, and I lay on the side where the pain is, gravity takes over and starts to push that disc out a little bit more, and it'll make it more painful. Avoid bending forward at the waist. So basically, when you have a disc injury, and we're talking about the disc bulging backwards, anytime you're doing this, it's going to make it push back farther. Usually people won't do that too much, and when you have a back injury, you're kind of walking around like this because you don't want to bend because you know it'll hurt. Don't sit slouched. Again, there's going to be a variation on how you can sit, but you'll know when you sit in the wrong position how it's going to bother you a lot. Usually we tell people to try to avoid sitting for a little while. See if you can stand a little bit more or lie down rather than sitting for a long period of time. Having said that, since it is a talk on back pain, if anybody has to stand up, please feel free to do it any time. Next one is don't sleep on your back. So when you sleep on your back, again, gravity is going to take over, your muscles relax as you sleep, and it's going to make you do this, and then that's going to push that disc out and cause more problems. So lots of times when people wake up in the morning, we tell them if they can, and your back is bothering you, see if you can roll onto your stomach for a little bit. See if that helps to get that problem to feel a little bit better. I mean, even if I have some type of pulled muscle or something like that, sometimes I'll roll onto my stomach or I'll put a little pillow underneath my stomach and lay there for a little while. It helps quite a bit. My wife, when she runs longer distances, her back tends to get really tight. So when she wakes up the next morning, her back is stiff, so she always takes the pillow, lays there for about, hits the snooze alarm and lays there for a little while, and it helps to relax the back. Then she can take a shower, stretch it out, and work a little bit better. And it keeps it from kind of building on itself, so to speak. SI joint. This one is a little bit tricky in the fact that the SI joint is the pelvis can rotate and move like this. It can slide up and down, and it can gap or go the other way. And so when we treat SI joints, the big thing is find out what mechanism of injury it was. Lots of times people will slip, or the other thing that we'll see is people will have motor vehicle accident. They'll have their foot on the brake and they get rear-ended. Or even though the foot's on the brake and they're running into somebody else, that force goes up and torques their pelvis. It's usually a kind of a torquing or a twisting motion that causes the SI joint problem. And people will feel like one leg is longer than the other, or they're walking crooked like this. And actually they'll come in and they'll be walking crooked and they're like, what's going on here? And we'll say, probably SI joint. We'll see what's going on there. Yeah, that would be a good idea. Or just don't follow so close so you won't hit them. Okay. So next one is stabilize the hips. So we're talking about the hips and pelvis are going in a little different position. So when we do certain exercises, we can give you what we call muscle energies, where we'll have you sit in a chair and push your foot into a floor, or lay on your back and push your foot into the floor. That, when you push on one side, it can help to twist the pelvis back into position, and you'll actually feel it go back into position. And then you stand up, and it's like, my legs feel level now. This feels good. It can go out when you sit back down, but if you have some exercises to do to help put it back in, and then do them frequently, it helps to keep it in place. Sleeping on your side with a pillow between the legs. Good way to do it, because usually it will be one side or the other side, because the SI joint is basically right in this area right here, and it's still called the sacroiliac, okay? And that one will, either on either side, if you lay on the opposite side, so you have the side with the pain up and the pillow between the legs, it's going to take pressure off of that and relieve the pressure on the nerve and help to take it off the pressure. I talked about the hip muscle energy. That was what I was talking about, pushing down into the floor. Avoiding bending and twisting quickly. So since the SI joint is a twist motion, if you sit in a chair and you go to get up like this, you can wind up pulling it out again. It's usually the muscles and things get imbalanced and they want to spasm one way or another, and that's why it'll hold it in that position. Okay? Piriformis syndrome. Piriformis syndrome, basically that muscle stretches from right around your tailbone, right around to the side of the hip, and it goes right across here. Your sciatic nerve goes right down the middle of it. And sometimes it'll do what we call bifurcate, where it'll be split, and it'll go right like this, and the sciatic nerve goes right in between it. They came up, not with necessarily this name, Piriformis syndrome, but they had a lot of truckers wound up with this issue. They would have this hip and buttock pain, and everybody said, oh, it's got to be the seats. They're bouncing on the seats all the time. This is a problem. Well, sometimes that's it, and sometimes they found out. I always was sitting there thinking, why do these truckers have these big, long chains on their wallet? Are they afraid somebody's going to steal their wallet, or what's going on? It's because if you sit on a wallet for 16 hours a day on that one side, it's going to start to cause pain because it's going to be pushing right up into it. And if you see most guys' wallets, they're really fat, thick. The thicker it gets, the more it puts pressure on. So what they started to do was to find out, hey, that's not a smart thing to do. It starts to hurt my butt. So when they're traveling, they need their wallet so that, you know, if they need to pay a toll or whatever, it's not flying around the cabin. They put on a little chain, throw it on the seat. Then it's there when they get it up. So I learned that when I was researching things on Piriformis when I was in college, on how they came along with this stuff. So that muscle gets pinched, and it causes the pain and symptoms down the leg. Heat works real well because it relaxes the muscle. Stretching works real well. That's if they lay on your side with the pain side up, pillow between legs. And then the do's and don'ts is don't sit or lie on that side that hurts. Some people will tend to lean to one side or the other side, and if you sit in a chair, you'll see somebody lean like this. So if that's the side that hurts, try not to lean on it. That pressure on it is going to start to feel a lot worse. And then avoid long sitting and standing. That muscle will get tight if you sit for a long period of time. It's going to get tight when you stand for a long period of time. It's a lot of muscle stretching and things like that. Last thing is try and keep stuff off. Try not to sit on a seat really hard where you get that extra pressure. Now, change that. Yeah, they have cushions on them. So I talk about. So for the first 72 hours, I had to, rather than the rice, a different thing to do. So I said, so cold and ice. In the beginning of injury, there's going to be inflammation. Down, so we use ice on it. The other thing is anti. Again, if you can take Advil, Motrin, that type of wonders in the very beginning to keep from building. If you're walking around for 2 or 3 days because it hurts, you aren't doing anything for it, then I kind of say that it's your fault because you have ice and anti-inflammatories to do with it. Sometimes, I say lay low or rest. Sometimes you can't. Okay? But when you can, there's those other things that you can do. And I said that, if you have a disc herniation, a stenosis, you have a muscle pull, whatever, 9 times out of 10, lying over a little pillow on your stomach, on your bed, will relieve some of that pressure. And you can put ice right on top of it, take that Motrin or whatever, and it can start to make it feel better. Or whatever other type of anti-inflammatory stuff you want to do. But getting the inflammation down is the big key. And then when we say maintain good posture, it's trying to make sure that you don't keep going into that bad posture. Okay? Although this feels better when your back hurts, the quicker you can get your hips underneath you and maintain that good posture, the better you're going to do with it. Okay? There are some other things. Now, when we talk about people that have chronic issues, I didn't put up a chronic slide, but I thought about that afterwards. I was driving over here thinking about what I was going to talk about. Chronic pain is a little bit different. You can use ice, but lots of times heat feels a lot better for those arthritic problems, for the stenoses, for that type of stuff. And, so heat, again, you can use the anti-inflammatories, lay low and rest. So if it's more than 72 hours, or if it's that chronic pain that comes on when it rains or it's nasty out, usually heat is going to make that feel a lot better to do that. Okay? So now we got treat your back right. Sitting posture. Feet flat on the floor, ears, shoulders, and hips in alignment. Don't overarch your back. So here, it looks like, boy, she's got really good posture. This is great. Well, what's happened is she's really stressing these muscles in her back here. And you can see her hips are here, but her shoulders are here, her elbows are forward, and she's really straining and craning her neck. So we talk about this poised and relaxed. So she's in a good position here with her posture, and she doesn't look like she's struggling for it. So that's what I'm saying. Everybody knows, okay, this one doesn't look good. But if I didn't have these down here and I said, which one's the best posture, they would say, oh, this one, this is the way you should sit. But if you have a stenosis or a disc or some problem like that, that may put more pressure on it and make you feel worse. Or if you have a muscle problem, that may make it feel worse. So we want to watch out for that. The other thing is knees lower than the hips. In a lot of cars out there now, and I don't know if I have a driving slide, but in the cars out there now will wind up, they want you to get in that bucket seat, and the hips will get lower than the knees, but it's not the way we want hips lower than the knees. We want it to be supported. And so, you know, lots of times people say, well, why does my car bother me so much if I'm sitting in there and my knees are up and my hips are down? Because he's telling me that's what it should be. Well, it's not really what we're looking for. So it doesn't really, a lot of the cars out there don't have real good seats for posture, and you have to play with the seat or add a cushion or do something like that to try and make that feel better. Lifting. Everybody thinks they know the right way to lift, but lots of times when I say, do you know the right way to lift, and I have people demonstrate it, they don't necessarily do it correctly. So what we're trying to have people do when they lift is making sure that you're keeping your center of gravity right in between your feet. So if I go to lift and do something like this, you can see all of my center of gravity now is going way in front of my feet. It's not staying in between my feet. If I start to bend my knees and push my hips back, then my center of gravity, my chest, where my center of gravity is near my belly button, stays right in that alignment and it stays really good. Well, if you can't bend down that far, what do? You kneel down onto one knee, get what you're getting, and come back up this way. Not always the easiest way to do it. Sometimes there's things that you have to pick up that are awkward, but trying to keep that form the best you can is great. The other thing is keeping it close to your body. So if I bend down and I go like this and I'm holding something way out here trying to pick it up, that's not going to do very good for my back. Try and get it in as close as you can. And lots of times, do you ever see the laundry baskets that are kind of curved like this? They aren't really a square one and they aren't a circle one. They have that little curve into them. Well, that's so you can hold it into your body when you're carrying it, and so it isn't out here. It's a little more ergonomic for you. Household chores, vacuuming, mopping, sweeping. This guy going to have a back problem right away because he's right like this and he's kind of doing this. That's just going to strain your back. It sounds kind of weird, but it makes a really neat pattern, is if you take the same size step and just kind of go back and forth like this. It's a shorter sweep, but like I said, on my carpet at home, it makes a real neat pattern, and then I have like 3 or 4 rows of it. It looks pretty cool. But this is the way you're going to want to do it, staying more upright and striding and working like this, okay? Same way with mopping. With mopping, it's going to be the same thing. If you're down here with mopping, you can see that's just going to hurt your back. And lots of times I tell people about this, they don't really think about it, and they do things, you know, they just like, I just got to get it done, and they rush through it. And then, you know, they'll have their back being great for 3 weeks, and said, oh, my son didn't have time to vacuum, so I had to vacuum, and I just killed myself. And I said, well, did you vacuum the right way? And like, well, I don't know, I just had to get it done. So rushing through it isn't necessarily the best way. Just kind of be aware of it. Same way with sweeping and those types of things. Carrying groceries. This is another pet peeve of mine, is that either, number one, you say don't overload bags. Well, they say, well, I'm not the one that's loading it, the person at the checkout's loading it. Well, usually the bags that they're giving you are a little bit small, but you can always tell them to give me more bags or not to put so much in, or, you know, lots of times now they're being more conscientious. I grew up in the grocery store, so, but they'll be more conscientious and they'll say, you know, is that going to be too much in that bag? Hopefully they will, but if it is, make sure you tell them so you don't walk out there with too many stuff in one bag. Carrying it close to your body. Lots of times I'll see people carrying groceries, and for some reason, I guess they don't want it to hit their legs. They're walking around with them like this, carrying it way out here. Well, that's just putting a lot of strain on it. Closer to your body is going to be better. Again, they seem like real easy things to do, but they're stuff that Julie and I see over and over again in the clinic, that people just make the same mistakes over and over again. So we're trying to bring them out a little bit more. Balance between sides. I talked about how if, you know, your right side is hurting, you don't want to load that side and all that. Well, the other thing is you can hurt your back by putting all the heavy milk and that stuff on one side and then just carrying a loaf of bread and your keys on the other side. You know, you want to try and balance it out a little bit. And then watch loading and unloading. So loading and unloading means if you're going to put it in the car, I always tell my wife, when it may not be the most convenient, but when she's trying to slam that thing of water and the 5 grocery bags in the back seat rather than popping the back and loading them in there, she's got a nice way to get in and out. If she puts them on the back seat or on the floor, the door opens, now she's got to twist and try and get in there, and you know, you wind up twisting and hurting something. So that's why I say watch loading and unloading. And then my nice little comic here, limit the bags you carry. It's nice to take the one trip, but try and limit it so you don't hurt yourself and actually Yesterday I had a patient come in who said they were doing great until they went grocery shopping and they wanted to get all their bags in at one time and they hurt their back again. Okay, computer work, everybody's at the computer. Adjust the chair, desk, and keyboard and monitor. So this whole thing functions as a group. Chair, desk, monitor, keyboard. Because if any of these are off in the wrong way, they're going to put stress on something. If the keyboard is too high, you can wind up with carpal tunnel. If the monitor is too high, you're going to wind up with neck strain. If the monitor is too low, you're going to wind up with neck strain. If the chair is wrong, you're going to wind up with back problems. If the desk is not at the right height, you're going to wind up either leaning forward or leaning backward. So what I like to have people do is you can see this monitor is kind of at eye level. It's going to hit the top third, so she just has to move her eyes in order to look at the whole monitor. Here, angle of the arm. I have there with elbows at 90 degrees or lower than the desk. So she's a little bit lower than 90. It keeps the stress so you aren't up like this. Keeps it down here, helps out with things. The other thing is we got the knees lower than the hips. And basically the big thing too is also where the desk and the monitor is. If your monitor, like if I sat at this desk, I probably would have my head sticking out this way because I would feel like the monitor's too far away from me. That's just my personal preference. So winding up having this distance here and how it's set up on the desk does make a big difference. With gardening and yard work, it's the same thing with like lifting, vacuuming, and all that kind of stuff. You can see he's kneeling down there to get closer rather than kind of like squatting or bending. You can see she's kind of hoeing in a little bit better position. And mowing the lawn, you don't want to be pushing this way. You want to be doing the other stuff. So my golden rule is don't wait to see your doctor or go to physical therapy if your back pain persists. You're always going to have some type of back thing. It'll go away in a few days. Well, if a few days turns into 6 months, then we have a problem trying to get that better. And I can't tell you how many people I'll ask them, how long have you had it for? They'll say 2 or 3 months. And I'm like, well, if you've had this 5 to 7 out of 10 pain every other day or every day for 5 to 7 months, how come you haven't gone to the doctor sooner and done that? I thought it would go away. Well, guess what? Normally, if you pull a muscle or hurt it, probably about 7 days max is when you should start to feel a lot better. Okay? If you aren't, you want to go see the doctor because maybe you tore it pretty good. As far as the back goes, I always tell everybody, if you give it 5 to 7 days and it's not feeling better, you can at least attempt to talk to the doctor or do something like that. Because if it goes on for a real long time, there's a problem. On the very other end of the scale, most back injuries are going to heal in about 3 to 4 weeks. So if you've been nursing it for 3 to 4 weeks and it's not better, get to your doctor as soon as you can. Because the longer you wait, the more movement patterns we have to try and change. You've been walking around in this posture for a long time. This muscle has been in a spasm for 3 weeks. It's hard to release those things when people come in. So, you know, if you've had the pain for 4 or 5 months, I'm not going to be able to get rid of it in 4 or 5 weeks sometimes. It's going to take a lot longer sometimes, and that's where the bad part is. So when Julie was saying it, get to your doctor, that's what we're looking for. Now, the other thing we have, sooner the better, direct access is another thing that a lot of people don't realize. Direct access is you can come and see a physical therapist without seeing your doctor for 10 treatments or 30 days, okay? And that doesn't include Medicare. Medicare has to have a prescription to do that. But we can evaluate you with Medicare, I believe. Is that correct, Mary Lou? So we can evaluate you. If you come in and you're like, oh, my back really hurts, I got to know what it is, we can evaluate you through Medicare, but we won't wind up doing any treatment unless a doctor prescribes it. That's Medicare's rules. But direct access is you can come in and we can give you up to 10 treatments and see if you're really having a problem or is it, you know, going to get better really quickly. If it does, then you're done and there's no problem. But that's why we talk about sooner the better. So that's where we are on that. So for rules of the healthy back, know your do's and don'ts, treat your back right, and follow that golden rule. Don't let it go for a long time. When I have people that have seen me for back issues and they let it go for a while, and then they get better, and then it bothers them again, and they come right back in as soon as it bothers them, they're like going, gee, that only took me like 3 treatments to feel a lot better. Last time it took me like 8. And I'm like, well, because you came in and we know what you're dealing with, and we didn't let that inflammation and everything kind of sit in there for you. So just a little blurb on us, Mary Lou Corcoran Physical Therapy. We said we're at the Fayetteville Town Center, near Tops, near the gazebo. Okay. We do orthopedic physical therapy, which is basically all your joints, body, neck, all that kind of stuff. We do sports rehab, so ACLs. We work with rotator cuffs and all that stuff for the athletes, the high school athletes, weekend warrior, college athletes that want to get back to doing sports. It's a little different than the typical therapy when we do things. Hand therapy we have there for pediatric physical therapy. And we also have some specialty in breast cancer for rehab for that also. On our sports performance side, we do running assessments where if people are having problems or difficulty with running, we take a look at that, see if we can solve or help a problem there. Golf performance, that's what I do also. Sports performance, some people might need, be having a problem with soccer kicking or, you know, those types of things. Or tennis, we can help with that a little bit. We also have some personal training, and we have Pilates there also. So we have a lot of integral stuff going on there, and it kind of makes it a nice, well-rounded facility. So you already have some of our brochures there, but that's what we have going on at our facility, and that's kind of where we are. Do you have anything else to add, Julie? All right. Well, that's my next slide. And thank you, and any questions. So if you do have any questions, you can raise your hand now. If you're shy and you want to ask us afterwards, that's kind of why we did it this. Yes? Sure. Oop. Right there. So, like I was talking about, she has some good posture going on here, and we have those knees are getting lower than the hips on this one. You can see her feet are up on something. And it's probably because the chair, if it's the level, that's where I run. My wife runs into that because she's only like 5 foot and 3/4 of an inch. So even when she sits in these chairs, she's kind of on her toes because her legs are short. So you have to put something underneath there to keep that leg pressure off. Because if the knees get too low and your legs are really supported, then it's going to start to put a lot of pressure on it too. So there's a happy medium here. You know, some people say, well, if I raise my knee, people chair weight, my feet aren't touching, knees are lower than my hips. That's not necessarily going to work very well with that. My knee, hip. Any other questions or anything? Work on that? Other questions?
I am sitting in a chair. The chairs are all the way up because I'm trying to be ergonomic to take rest of the chair. And I find that I think my legs are bothering me because my head is so lower than I do. Should I put a pillow or a cushion on it to build myself up?
Yeah, you can do that. You can put cushion in there, you know, and basically the best thing you can do, you're right, it's hard for you to tell exactly what's going on. So the best thing to do is have somebody take a look at you. You know, sit down in the chair and somebody look at the sock. You know, because the other thing that we find is a lot of people really don't know. Like, we'll have people come in and stand like this, and I'll say to them, do you really feel crooked? They're like, no, I feel normal. Why? And it's like, well, you're standing crooked. Like, I am? Like, and you're crooked. And you can look at it, yeah. And yeah, for posture and all that. But yeah, I mean, you're gonna you can add certain things into there. I mean, yeah, at our office until we were getting some things that would go up and down, we would have phone books to raise it up or a half a book and a piece, some great. Yeah. And that's what you have to do. And like you said, that's why I said it's important to know where this desk is. I mean, this one is kind of really ergonomic because this desk actually goes up and down. Okay, so they have that made, but you can't afford those. So if the desk is actually too big for you or too small for you, it's really going to hurt. You got it. Yeah. So I mean, sometimes that, and if the chair is up as high as you can go, if your feet aren't so sitting flat on a floor or something like that, sometimes it might be that you need something underneath that desk to put your feet on.
No, I think my feet are up, like I'm sitting in the chair and I feel like I'm like this.
Okay.
So I'm usually sticking my feet out in front of me to relieve the
Yeah. So I mean, so that's it. Yeah. But, yes. Oh, okay. Mm-hmm. Well, you don't necessarily have to sleep that way, but to relieve some of the pressure, sometimes that's the best way to do it. Sometimes you can, like I say, people that say, have you ever laid on your stomach? Well, I can't sleep that way, because they might have a breathing problem or an issue that way. But they might be able to lay like that for, say, 15 or 20 minutes before they go to bed, which relieves the pressure and calms it down, lets the disc set in. And then you can maybe roll onto your side or get into a better position on the side. So if the pain goes to the right, you lay on your left side and have that pain side up, and you can sleep that way. And that's what we'll tell people. Or if you wake up in the morning because you were in a bad position, and you can roll over and either be on your stomach or try that pillow, and it should help that out quite a bit for you to do it that way.
My pain is always this side. So should I be sleeping my right side and put the
pillow between the legs? Yeah, usually right side and doing that.
Because my left side is very short. Even though I'm sitting here, I felt that's why I had to take it out.
So that would it be. So pain side up, pillow between the legs. And sometimes you have to use more than one pillow. Sometimes you got to do 2 pillows. It depends on how thick they are and all that kind of stuff. So that makes a difference. So the one thing I always tell all my patients, my biggest thing is education. So if I can get you guys thinking about the stuff you're doing at home, and now all of a sudden when you go to pick that up, you go, ooh, wait a minute, I got to do this. Or when you get in bed, you're going to lay a different way, or you're going to do that. Sometimes those little things that you do throughout the day, just like the little things add up to the big things, well, those little things that you change throughout the day can add up to a super big change in the way your back feels and what goes on with it.
So I have one more question.
Sure.
When the doctor does the MRI, does everything comes in that MRI? Is it really giving you the real picture? Suppose everything?
The MRI will show you the majority of the stuff. And what I always tell everybody is that X-rays and MRIs are good for basically validating or verifying your diagnosis. When I went to some of the courses where we do MRI reading and X-ray reading and stuff like that, they would say, okay, throw up this X-ray and tell me where their pain is and what's wrong with them. And you look at it and you go, oh, I see he's got a little fracture there, he's got a bone spur there, he's got pain on his right side going down his left or down the right leg. And then all of a sudden they go, he's pain-free. They throw up the next one, an MRI, and it looks perfect, pristine, like you could draw it, and it's like that. And then you go, okay, that person has no pain. No, he has pain down both legs. So it's one of those things where they help us, because if it tells us you have a L4-5 disc, and then they say they do the MRI and it's an L4-5 disc, then it helps us try and isolate your exercises better when we're doing PT.
Sometimes you can have, like if we MRI everyone in the room, several of you might have a disc ball so you don't see it. Sometimes it'll show things that might not be seen yet.
Yeah. How about the nerve block? I have done nerve block, and sometimes they help, sometimes they don't. So what do you...
Well, and that's exactly it. The nerve block is, I tell people, it's kind of like a work of art, so to speak. It's kind of like a person can give you a massage, and it might feel great, and the next time it's a little different person, and it doesn't feel good. Or the same person can do it. It's just how you hit it right. And, I mean, the nerve blocks, you got it. And it's very specific. And, I mean, when you're talking about, the space between your vertebrae and your nerve and all that stuff, you might get it in the right spot, and it works, and you might not get it in the right spot, and it doesn't work. So, but like I said, I like doing these because I really feel that education is the best way to get people out there. Because, the little things that you do, I mean, even if you come in and see me 3 times a week, I'm only seeing you for 3 hours in a whole week. You're out there doing everything all the rest of the time. And, if you can do just one thing not to make it get worse, then that can pile up and make it a lot better. Okay? I don't want to keep you guys standing here for too long or sitting here for too long. Any other questions at all? Okay. Well, thank you very much. Oh, go ahead. The posture slide? Oops, I went the wrong way. Yeah, I know where you're talking about. This one here? Yep. So like I said, this is the good posture. This is the one we want. Kind of relax, and this one is, it's like it says here, forced upright. So that's not going to be good, and then we already know that this slumped one isn't going to add to anything good.
Your homework is to go home and practice your posture. And then come in the next time and you're like, my back is killing me. Because they've been doing this for 2 days, and that's not very comfortable. So that's why the poise relax is a little bit better. You're kind of in between the outs and in between arch.
And that's why we're talking about, you know, being aware of it and knowing that can make a big difference. Oops. Yes. Yep, that is true. Yes. Yes. Yep. Oops. No, the distinction is this will be herniated, and basically a bulging disc is going to come out like this, and all of this stuff is not going to be going out into that area. It's just going to be kind of blooped out a little bit inflamed, and it'll be bulged. I have a couple of bulging discs in my back, and it doesn't bother me where I am because they're not pressing on anything. And here is that jelly donut I was talking about. So if this was a 3D, it would come in a circle out this way. And this is the center stuff. And this is the annulus that's on the outside. And this is the nucleus propulsus. And what it'll do is this moves back and forth. We can see this one is squished, and now that nucleus propulsus is all the way out here. That's a herniated disc. Okay? Whereas here, if this outside here just bulges out, but this stuff doesn't move all the way out here, that's going to be a bulging disc. And then you can have a ruptured where this red part here actually breaks open and this stuff starts to come out. And that's a ruptured disc. Yeah, it's going to be a really irritation to the nerve with that. Because this fluid in here, when it's in this part, it doesn't bother us. But when it comes out into the actual body and gets loose there, it's like acid on the nerves, and the pain doesn't go away. And you can put them in any position you want, give them any medication, and it doesn't do anything for it. Yes. Yes. Yeah, so oh, yeah, it can be a sudden pain, but it stays. But it stays. Yes. Yeah, but if you herniate a disc, it hurts because, like I said, or I should say, if you rupture a disc. Herniated disc is going to hurt too. It's going to hurt a lot, but a ruptured disc is going to really, there isn't anything you can do to change it. Well, sometimes they can heal, but sometimes that's when you may have to have some surgery, if you have to have disc surgery, to try and fix that spot a little bit. It all depends on how it heals. Yeah. So that's why I was saying in the beginning, if you do that stuff, it can really make that start to go back in and let it heal better. Well, yeah, there are exercises. You can do some, if you come in and we know that there's a bulging disc and you're having pain and it follows the disc pattern. You bend forward, it hurts more. You lean to the side, it hurts a little bit more. It's going down the one leg and it follows that disc pattern. There are exercises we can give you to help out with that. And then what it does, yeah. Without a without a doctor's script, yeah. And what we do is, we have to check to see if the insurance, works that way also. But the majority of them will wind up doing that with the direct access. But again, I always tell everybody, if you don't know, you can always, call us and we can try and check that out for you. But we usually will have, sometimes we'll know because we use that insurance. And sometimes we'll say, well, we have to check. You have to check on benefits and find out where you're going with that. But the majority of them will do that. They'll let you come for the 10 sessions and work with it that way. Anything else? All right. Well, thank you very much.